Okay, so this is where a lot of the marks will be, I think, because there's so many different things that you can include. So this is the way I've structured it. So talk about the general treatment, how you would recommend treating the patient, and then talk about where they're going to be. So they're going to be in hospital, they're going to be treated at home. Are they going to be treated by a specialist, or are they going to be treated by in the community by the GP? And then these three to six, these points here are really important. So safety netting, again, that's one of those things that when I talked about red flags earlier when taking the history of presenting complaint, this is another thing that in some scenarios, if you don't include it, you'll fail the station. So it's really important, not to forget, just to have that dialed into your structure, that you need to do the safety netting to make sure they didn't get lost. For example, so say if you did refer them to a specialist, but then they never, nothing came about of it, you can say, if you don't get seen within this period of time, then please do come back and we'll see what we can do. Again, if they experience like an exacerbation of their symptoms, if their pain gets particularly bad or they experience any red flag symptoms, then they can dial the emergency services number, or they can come back to the hospital. So that's really important. Follow up. So I'd like to see you in a few weeks. Time to review your condition, and leaflet. So that kind of will accompany the explanations. You might want to begin talking about the leaflet when you're explaining things, if you feel like there's more information that they need to understand to move forward. Yeah, the last few things: summarizing the management and checking understanding. So again, I think the good times to summarize are at the end of history taking and at the end of the management plan. If you've got time, I think it's worth doing a brief summary just to make sure that you're on the same page. And then again, if you wanted to include any the expectations part of ICE, this might be another opportunity to just to make sure that you haven't missed anything else that they were hoping for. And again, we've done a few cases in these sessions, and often what happens is that at the end, the doctor's finished asking all of their questions, they finished the discussion, and they kind of don't know or haven't prepared how to end the consultation. So I think it's just important to be really polite to the patient, thank them, telling them it was nice to meet them, rather than just kind of stopping it abruptly and looking at the examiner. Again, an important point about involving the patient shared care or patient-centered care is really important for the management plan. So you need to be very careful with your terminology. So would instead of will, or could instead of will. Yeah, so that kind of thing. So advise and recommend instead of you need to do this, or I mean, there might be some instances where you might be a bit more forceful with the patient, like someone with peripheral arterial disease who is about to lose their leg, then perhaps, but although I doubt that scenario would be in the exam. So unless you've got something like that, it's best to always be kind of more on the shared care kind of side of things. Do you have any thoughts about this or any preferences? That's another way of asking them about what their opinion is. So I think a good structure is to tell them what the options are, tell them what you would do, which of the options you would choose, and then ask them for their opinion about that, rather than telling them this is what we're going to do. Is that okay with you? Or even worse, saying this is what we're going to do. Deal with it, basically. So they're your three options. So it's kind of, that's the kind of the optimal way to do it, is kind of to present the options and then have a discussion, a two-way discussion about what's best for them, and then come to a mutual agreement at the end. So yeah, I mean, is there anything else, Dr. Rana, you'd like to add? Sorry, I've been calling you in. Apologies for that, by the way.
No, I think that's about it. Really, I think, yeah, you've explained in terms of what you need to do, and I feel try. I know you will be nervous, especially in the exam setting, but make sure that you carry that friendly approach with you to give the impression that you are in control of the situation. And yes, you can summarize at the end, just to make sure that you and the patient are in the same wavelength, but make sure the summary is as brief as possible, because again, we don't want it to be like a rehearsed summary or like a lengthy summary, making it a bit artificial. So if you're going to summarize, keep the summary as brief as possible, I would say, and make sure that it is natural, like into the history of presenting complaint, rather than something that you artificially add on. Yeah.
Yeah. Thank you, Dr. Rana.